So I came to Primary Children's Hospital when I was 15 years old. I'd had a car accident up in Mount Hood, Oregon, and had a spinal cord injury, a mild brain injury, and a lot of orthopedic damage as well. I was in the ICU in Portland and then transferred to Salt Lake City at Primary Children's to do my rehabilitation. I think this institution is really special, and one of the things that made my experience so profound and important to me was the way that all of the staff, the physicians, the nurses, the therapists, everybody kind of figured out who I was and what motivated me, and they all latched onto that.
They don't just do their job, they do so much more than their job. They're always there to be a friend and to be a motivator and to play off of personality types. And they knew who and how Owen was and made a game of those things so that he would stay motivated and always made sure to peek into his interests.
It was very quick for us to realize that this is something that they do every day, and it's something that their goals are aligned with ours, that our goal is to get Parker to be able to feel like a kid again and be able to do the things that he's done before, even if it looks a little bit different.
A lot of people in the area of neurorehabilitation focus on walking or returning to sport. To a lot of patients, that's not actually what's most important. Sometimes the biggest victories we can get are helping somebody be able to brush their own teeth or guide their own wheelchair or become independent with bowel and bladder care. And so each one of those steps can represent a really meaningful transformation in someone's life.
When he came to primary, the first thing I said was, "Is there a music therapy program?" And it was still in the shuffle of, there were more important things for his care at that time. And once he got to a better place physically, the doctors knew she's gonna ask about music therapy, make sure to get that onboarded.
I was passionate about music before. I played guitar and piano mainly before, but yeah, I don't remember this, but I was told that I was playing music again before I was talking and walking again.
I remember the first time meeting you, Owen. I remember when we brought in the piano, I think for the first time, I think you played for just an hour straight.
When they first put him on the bike, it was way too painful. And we just remember them saying, it's okay, this is just for us to know what we're gonna work towards. And within a few weeks he was on it and it's not hurting, and he's asking for one at home. I think that's been my favorite thing to watch, is see how they make therapy fun. They play games, they have fun. It's quite the riot in there. It's not uncommon for him to come back laughing and smiling after therapy, for sure.
I've seen so many improvements. Like my first one, when I got here, I couldn't hold myself by sitting up, but now I can. I'm working on getting my legs stronger so I can eventually get back to standing and walking.
I think there's a perception that rehabilitation is a sad space, because it really is people who come here at the lowest point of their life, or they come after the most tragic event of their life. And my experience with rehabilitation, both as a patient and now as a physician, is that I think the happiest place in the hospital, because we're just so focused on the future and on progress, and you see progress every day.